The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
What are the main risks of facelift and neck lift?
Yeah, I think the biggest things we're concerned about are bleeding and the nerve. So interestingly, I don't think infection is a big concern because the bleeding's so good. If there's good blood flow, there's less risk of infection. Well, the problem is the face has such awesome blood flow that this is what we worry about. We want to control your blood pressure, make sure you're not on any blood thinners, make sure as surgeons, when we're operating, everything is dried up. There's no bleeding at all before closing it. And that way you don't have a hematoma after surgery. The other big risk, of course, is that we have the facial nerve, the nerve that gives us animation or emotions. It's sort of rare to very difficult to actually ding the actual facial nerve. It's more a concern of dinging or potentially damaging branches of the facial nerve, which is why knowledge of anatomy is so important, and avoiding the branches or where they are is the best way to prevent this from happening.
Yes. So you can have weakness afterwards. It's rare to have like complete paralysis after, but sometimes people feel like their mouth feels a little bit funny afterwards, or they're smiling a little bit broader on one side versus the other. And most of the time it's just that the nerve maybe has been like stretched or something like that. And so it just needs a little bit of time to come back to life. But rarely you can have paralysis, and that of course is a major complication and a little bit higher risk with the deep plane because you're closer to that nerve. So you need to really be, you can absolutely do the surgery safely. You can do both styles safely, but you need to know your anatomy. You need to know where you are. So very common question. We get asked, I think, about every surgery we do, but how long does a good facelift last?
I think weirdly enough, we're finding out that it depends on your body, how much you take care of your skin, and how much you take care of yourself. But I think it should last about 10 to 15 years. And this also assumes that you don't gain 75 pounds and lose 75 pounds. You actually protect your skin from the sun. You're not decided to smoke 2 packs a day after surgery of cigarettes or whatever. Assuming you do all the good things, it will last a pretty long time. It's actually one of the more cost-effective procedures, amazingly enough, in aesthetic surgery. So do you have any hints for patients on how to maintain their facelift?
Yeah, so I completely agree. So beyond the genetic results or the genetic component, just like your own like tissue qualities, which if you're blessed to have that, that's great. I completely agree with lifestyle. So we know high sugar consumption is terrible for skin. Drinking is terrible for your skin. Exercise is great for your skin and healthy living. So eating a rich, balanced diet, wearing sunscreen every day, not going out too much in the sun, all those things are going to help. And then I would be doing procedures like we talked about. There's so many things that you can do afterwards to enhance and maintain your surgical results. So whether that's resurfacing later, lasers, microneedling, doing like chemical peels to get rid of the sun damage, Botox, and then, as volume loss continues, conservative filler injections. Those are all great ways to keep your face looking youthful and balanced, because it's not that aging won't continue, right? We always say we're resetting the clock with your facelift or your breast lift or whatever it may be, but time will march on. The key is after 10, 15 years, like you said, you're not going to be back where you were plus as if 10 years of aging had happened. You're just going to slowly continue to age from your new set point.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.